About 15% of the world's population have some form of disability. According to the World Health Organization, people living with disabilities have limited access to healthcare services and therefore experience unmet healthcare needs. That's our focus today on Sound Health. I'm Olazumbo Modupe. Welcome to the show. Thanks for standing by. It's still Sound Health on Lagos Television, and today we are looking at inclusive healthcare system with special focus on access to health facilities by the vulnerable people in the society. And I have with me Dr. Veli Emina, a public health physician. Welcome to Sound Health.
Thanks for having me. I'm glad to be here.
I know in Lagos State, the present administration has a strong policy on social inclusion for the physically challenged. In your years of practice, do you think the vulnerable have enough access to health facilities?
I think the physically challenged, they need access to healthcare. And I will not say right now they are getting enough access to healthcare. And that was why we are talking of universal health coverage. We've all heard about it. How to ensure that everybody, everywhere, whether you are physically challenged, whether you are handicapped, whether you're normal, whatever the definition is, should get access to healthcare. And we are trying to achieve that. It's part of what we're trying to achieve. And also to reduce the financial burden or the catastrophic spending on healthcare for everyone, including the physically challenged.
So, doctor, what are some of the factors responsible for their non-inclusion or limited access to healthcare facilities in the society?
I would say they have limited access to health services because of one or two of the challenges that they experience. They cannot compete with others to get the access, because we all know that for you to access care, you need to at least leave your house early in the morning. You need to go to the hospital, get a card. And so the rigor of them living without anybody coming to help or support them. Imagine somebody that cannot see. If the person will wake up in the morning, get himself prepared and all that. So the rigor of all that, that's some of the factors why they cannot get. And the way some of these things are structured, we don't have maybe a special place where they can go and access care. It's just one healthcare facility that everybody will have to go to. For instance, if you have a special center, that this place is only for the physically challenged, at least the number of people you meet there will not be too much. But when everything is lumped up together, those that are physically challenged want to get access, and so they might not be able to compete with them to get the access.
Okay, doctor, apart from environmental factors such as access to healthcare facilities, do you think the attitude of healthcare officials contribute to this? Because I've had cases where even the people living without disabilities, they experience the unbecoming attitude of some healthcare officials, let alone the physically challenged. What's your take on that?
Okay, I won't say that categorically that the attitude of health officials are bad in that life, because in our department where I work in with the community health department, we're usually very friendly. We try as much as
Are you
possible.
saying that because you're here?
Not because I'm here, it's just because of what we've learned over the years. For me, I'm today we're a patient. I'm a doctor. I can be a patient tomorrow. So the way I treat people now will determine how they treat me in return later. So I put at the back of my mind. But with that at its may, we have different personality. We've heard of people saying some pastors are there, lawyers. So it's a matter of personality, not because you're a healthcare worker. So it's not all healthcare workers that's, like we said, that their attitudes are unbecoming. There's some very lovely, nice people, even despite they're working under pressure. They still put up a smiley face. They still attend to you very well. So I don't think the attitude of healthcare worker, whatever maybe they are nice, should affect anybody from seeking healthcare, because what you want to achieve, your goal should be paramount to you. So regardless of the way anybody reacts or behaves to you, you should be able to get the healthcare worker. But if that is me, training and retraining of the health workers too could also help to solve that problem.
People living with disabilities seek more health care compared to people living without disabilities. They have greater unmet needs. A recent survey, according to the World Health Organization, says people with serious mental disorders, maybe they are physically challenged or visually impaired, show that between 76% and 85% in developing countries received no treatment. What's your take on that?
Well, receive no treatment. That no treatment, I will not agree, because there's no way you say they don't receive any treatment. But I would say that, yes, there's limited access to healthcare for some factors. One, some of them cannot even afford to pay for the healthcare services, okay? Because they cannot even go get money for themselves. They're not working. And even the way our system is structured, if you see someone that is physically challenged and someone that is not, will you employ do you understand? So we have our challenges. Most people, even me as a woman, when I was still looking for a job, some people will say because you're a woman, you will get pregnant, you want to go for maternity leave, you will go this. I wouldn't want to apply. In fact, I'm looking for a male doctor. So we all have that kind of challenges. So no treatment I will not agree to, but we need to work on it. There should be a policy in place to say, okay, in an organization, 5% should be for people that are physically challenged, so that is when they have needs, they should be able to meet their needs, able to have money to spend to access healthcare. Apart from that, there should be insurance, because those people that are physically challenged, they can access healthcare if there's insurance. Do you understand? They don't even need to think of the cost of getting healthcare. And so there should be special centers for them. Rehabilitation centers, vocational centers, where they can easily walk to get access to health. And the doctors or the healthcare workers that should be working in those centers should be properly trained. To manage these people with one form or the other of disability. Because whether you like it or not, those people might need counseling at every stage of seeking healthcare.
What about free healthcare missions? I have this belief that the less privileged in the society are hardly targeted when it comes to organizing free healthcare mission, free cervical cancer screening, or free breast cancer screening.
The take is, I don't think they're not included. What I think is that they don't come because of...
Why?
Yeah, maybe because some of them might not have, like I said before, someone to bring them there. Some of them might not even know that program is ongoing or all-inclusive. And because of the stigma, do you understand? Because of the stigma that if I go there now, they will look down at me, they will crumble at me. Because imagine if there's a queue up and people are rushing to, they can get stumbled, they can fall down, somebody can even crawl, what's the right word? Can even mash them in the process, they can get injured in the process. And that's because they've learned to create a special center for them, where it's visually disabled people. But for example, in our own clinic, in our clinic, we run family planning services. We do pap smear or cervical cancer screening. We do breast examination, and everybody is included. Whether you're disabled, whether everybody is supposed to come. And we don't discriminate at our clinics. But also than not, we don't really see a lot of them. Not because we don't want to attend to them, because they are not even there. Like in our clinic now, we are in the second floor. Somebody that cannot walk, we have to use the lifts. And the person might not have somebody to even bring him up, to take him from his house to that place. So there's still a lot that should be done in that regard.
The rates of disabilities are increasing due to aging populations and increase in chronic health conditions. What is the way forward?
Yeah, the way forward, one, is because there are different levels of prevention. So the way forward is to start from the first level of prevention, which is primordial. By primordial, I mean that the risk factor is not even there at all. So you want to see as much as possible to prevent those risk factors that can help the person develop those forms of disability. But there are different forms of disability: physical disability, emotional disability, mental, so different. So you have to start putting those measures in place that will make people don't have those kind of disability. One, good nutrition, health education, because some people they have this disability maybe during birth. Some children are able to have cerebral palsy because the mother didn't attend antenatal care, maybe had difficult delivery, and they ended up with issues and problems the child did not even have. There's some are even genetics. So we start from that level where you health educate people, you create awareness, let them know that okay, this and this and this and this. Do you understand? And the creation of awareness will be from the community. You must create awareness from the community. Get involved all the stakeholders like the pastors, the clergy, the leaders, community leaders, the women. Let all them be on ground and say, get a message across for each particular one. Then apart from health education, creating awareness, good nutrition. Because sometimes some infection will not even come in if your immunity is good enough. Everybody in reception, there's no money to buy. But at least good nutrition, poverty elevation program to ensure that heads of families, head of home, they have job to do, they can take care of their needs. Make sure the environment, we have good roads. Because some people, they have good 2 legs, they have good eyes, they're involved in an accident, they have to amputate their legs. Some people, they have something like maybe diabetes, hypertension, they end up with stroke. So all these things must have to play in place. You eat healthy, the roads are good enough, there's money to get things that you need to do. That's the primary. At that point, there's no risk factor, there are no issues. They'll now go to the level of the primary prevention. The level of the primary prevention, you're trying to protect those people that are at risk of developing some of this risk factor. Let's take example physical disability. Okay, you target targeted groups like the drivers, the road users. You ensure that they use the seat belts. Do you understand? To protect them, because that will protect you from in the first instance. You put things in place that will protect individuals from developing that condition in all aspects. Then you go to secondary prevention, and I will talk about early diagnosis and prompt treatment. So you have to put things in place that can enable people to detect the problem immediately and ensure that there's treatment. Then the third level of prevention, which is the tertiary prevention. It means people already have this issue, they already have the problem, but you want to limit damage. You want to limit how far that thing will cause problem for them. You want to limit damage, and you want to rehabilitate them. So you want to take them, you want to treat them, you want to limit the damage, and you want to rehabilitate them back to the society. Maybe somebody was maybe an engineer that used to build a house before. Now the person was involved in an accident, the arms and maybe the legs are off. You don't sack that person. You rehabilitate that person to another position so the person can still take care of daily activities. Do you understand? Maybe take her from building houses, take him to the office to do other work that can suit his present condition. So I think if we follow those levels of prevention, we'll be going a long way.
Okay. How do you think inclusive healthcare system can be achieved in the society?
We are having a conference what we call tagged inclusivity, diversity, and quality in health education and health services. Because like we all said, the statistics are there. The vulnerables, they are not being considered in health services, in education, in law, even in justice. They are not well represented. So this conference is trying to bring everybody together because there are issues. So I mean, and the earlier we start to include everybody into education, into health services, the better for us. That's when we can meet the SDG goals of health for all, of healthy living, SDG 3, healthy living. So this conference is meant to address that. And so we want to advise everybody to come for that conference because the conference is free for everyone. You're not going to pay anything. You just come in to contribute your own quota. What you think you want the government to know, what you want us, the experts, to know, your own contribution, because everybody should be included in health, should be included in education, their right to be protected. So that's what the conference is all about.
Okay, in your own view, what are your final thoughts for people living with this condition in the society?
Final thought on it is that people living with this condition, they should keep the hope up. It's because you have one challenge or the other does not mean you're less of an human being than the other person. So because I know of a story, a renowned a neurosurgeon, when he gave birth to him, they said it was not going to, there's nothing good can come out of his life. But he didn't listen to them. He kept on doing what he was doing, and he got to the peak of his career. We've seen a lot of people that have one form of disability or the other, they'll be able to go far. People that have, maybe you say they have Down syndrome, they'll be able to manage it properly and they're doing so well. But we need to start including them in our health education, in our legal system, in the justice system, in the environment. We need to create pathway for those on wheelchair to be able to move freely. We need to structure the hospital environment in a way that people that have one form of disability can easily get access to health services. We need to create centers where they can easily walk up to. And this is one of the things this conference that is starting on Monday, 11th of September, the 13th of September, is going to address. So everybody should come and contribute their own quota to the conference.
Thank you so much, Doctor, for sharing your expertise with us on the program.
Yeah, I'm glad to be here. Anytime I have to contribute to the public, I'm always glad to be here.
That was Dr. Veli Emina, a public health physician, on achieving inclusive healthcare system in the society. Soundhealth continues with trending and home essentials. Please stay with us. This is where we say thank you on today's edition of Sound Health. Hope you've learned a few things. Please share your thoughts with us on 0818 815 3695 or follow us on social media at LTV Social, hashtag Sound Health. A sound health is a sound mind. Make healthy living your choice.